Hello, everyone. We are live from Ave Maria, Florida, Cadenza Medical Clinic, with beautiful people around me here. Today, we're going to talk about stem cells. Very alluring. Do you know that if your body actually, if you're adult, you have stem cells that they can potentially regenerate and heal your own damaged cell. So if you like this kind of topic, please hang on. We're going to dissect what stem cell is, what are the sources of stem cell, what are the indications of stem cell, or what conditions might benefit from stem cell therapy, because practically anything, any cell can be produced from a stem cell depending on the source of stem cell. So Florida, the state of Florida, is also very exciting because it allowed the the use of stem cell in therapy in medicine. This was in July 2025 in the state of Florida, just recently. So begin. What are stem cells? So essentially, you cut your skin. Why does it heal? Because the stem cells around the skin would actually would regenerate those cells. Why is there that if you're fasting, potentially diabetes can be cured? Because fasting stimulates the stem cell theoretically in the pancreas that was damaged to produce stem cells and new cells in the pancreas. So we have it. You don't have to go to somewhere because yourself can regenerate your own stem cell. Then the question is this: there are parts of the body that needs some stem cell therapy. For example, a broken bone, a broken cartilage, um, heart that is damaged. So would this be a potential source of stem cell therapy? It is. The question is, stem cell therapy is very unique because it has to be in the proximity of the damaged tissue for the stem cell to grow in itself to become that tissue proximate to it. So hi everyone, we are talking about stem cell. So hang in there. My question was, what type of condition might be benefited from stem cell? But back to that, what are the sources of stem cell? So let's talk about the embryonic stem cell. What is an embryonic stem cell? Embryo, which is the product of the growth of a sperm and of the ovum, such that in day 6 of this development, the cell becomes 2, the 2 becomes 4 cells, the 4 cell becomes 8, 16, and on the day 6, 5 to 6 days, that's the blastocyst. If you remembered it in embryology, day 6, where there is the cell will have its core, and the surrounding cells in the lining the core are the ones that are scraped and would become stem cell, and that is called a specific type of stem cell called embryonic stem cell. So embryonic stem cells has the property of a very interesting type of cell because it can become almost any cell type in the body. And that could be uh, counterproductive because imagine if you have a stem cell that is sent to the body, an embryonic stem cell, it can potentially become a bone cell, it can become a muscle, hair cell, and there's a tumor called teratoma where there's different types of cell in that tumor. So it can just explode. For example, a stem cell can, let's put it this way. If in a petri dish, you have this petri dish and you put a bone or a heart cell, when you put a stem cell inside that heart cell, that stem cell will grow to become a heart cell, a beating heart cell. And in fact, if I could demonstrate here, show uh, the video, it will become a beating heart in the petri dish. So imagine, and we need to imagine, that if your heart muscle is damaged and you put a stem cell directly to the damaged heart, then that stem cell can repair that heart. But the question is, how do you deliver the stem cell directly close to the damaged heart? For example, the brain is damaged. How can you put the stem cell travel from the periphery, inject, go to the brain, and heal that brain? That is the reason why the most studied are those pairs of the ligaments in the knee, for example, in the joints. In fact, the 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 law only allows certain types of stem cell therapy because we know for the fact that other conditions, such as um, the examples of the categories that are included in the law of Florida that might benefit are knee, hip, shoulder, and other joint injuries. Because imagine if you have stem cell, if you have a broken cartilage, you put a stem cell, that stem cell will regrow into a ligament. And it's easy because you can inject to the joint, stem cell will just be there. It's very easy to reach. Tendon and ligament tears, for example. So this is great because then it might spare you from having surgery for these kind of injuries. Back and neck pain, depending on your skill, fluoroscopy, guided therapy directly to the point of injury can also be indicated. Another sports injury that you can that is in the scope of practice of the practicing physician. Chronic wounds and ulcers, for example. If you get a stem cell and then you put it in the wound will heal and regenerate. And even plasma therapy or PRP has been tapped into being used to produce healing of the wound. So Florida law does not mean stem cell therapy is approved for every condition. You might have some advancements of stem cell therapy online. You can go abroad somewhere, name it. And many clinics would advertise stem cell treatments for conditions such as Parkinson's disease, Alzheimer's, autism, multiple sclerosis, COPD, heart disease, erectile dysfunction. But in the state of Florida, these conditions are not blessed by the law. There's some limitation because it has to be proven by science that these diseases can be treated effectively, scientifically, from studies with stem cell therapy. So let's separate the law. The state of Florida is very specific for the law in Florida. It doesn't mean also that the FDA approved conditions treated with stem cell therapy can be done here in the state of Florida. You have to state also that the treatment that you're doing, non-FDA approved that you're doing it, but the FDA would have to scrutinize you and audit you and say, what is your basis? It is not FDA approved. Yes, you're in the state of Florida, but still, there's still some auditing and scrutiny. So it's always good to limit yourself in terms of what you're treating, responsible treatment. Because there's a lot of promises in stem cell therapy that is not necessarily guaranteed to be effective. And because there's an ethical issues as well. That's the commercial issue that the cost of stem cell therapy has a range. It's not regulated. It can be as small as a few thousands to 10,000 or sometimes 20,000 for the promise of treatment for those miserable conditions like multiple sclerosis or some debilitating conditions with no proven therapy. In theory, it could be. In fact, when I was anecdotally, I was I was in I attended this conference, ethical conference in Padua, and I was sitting with the experts all over the world about ethical issues of stem cells. So there was a scientist from Europe. They were working in the lab about multiple sclerosis and demyelinating disease, and they said they have some promise. Unfortunately, in the United States, you have to pass through the scrutiny of the FDA. So what are the sources? What are the types of stem cells? We talk about embryonic stem cells. We talk about scraping the cells in the blastocyst and basic. So ethically, the law of Florida respect life. In fact, it is in this statement 459.0127 stem cell therapy, titled Chapter 459 Osteopathic Medicine, Section 0127 Stem Cell Therapy. The legislature recognizes the significant potential of stem cell therapies in advancing medical treatments and improving patient outcomes, and further recognizes the need to ensure that such therapies are provided using stem cells obtained in an ethical manner. The state of Florida, the law would say, that does not involve stem cells derived from aborted fetuses. Not in Florida. You cannot use them. Besides aborted embryonic cells from fetus can divide into different types of, name it, different types of cells in the body. If you put a stem cell, it can, in a bone, it can also propagate into some different stem cell tissues around it that you don't really want to grow. So it is the intent, continued, it is the intent of the legislature to foster medical innovation while upholding ethical standards that respect the sanctity of life. It is a law of Florida. By encouraging the use of stem cell sources such as adult stem cells, umbilical cord, and other ethically obtained human cells, tissue, cellular or tissue-based products, that the state will advance regenerative medicine in a manner consistent with the values of the state. And I said, and it added the sanctity of life, respect for the sanctity of life. So what are these types of cells? One most common are the adipose tissue. So we do a mini liposuction. Unfortunately, some people would like, oh, can I have more of these? It becomes a liposuction plus harvesting the stem cell. Then would be the bone marrow aspiration, which is a common medical procedure, very safe and very accessible. Pain, there might be pain, but if a skilled practitioner does it, it really minimizes the pain. You numb the area, and it's just I should have brought the trocar or the bone marrow aspiration needle that even kids undergo this kind of treatment. And then you process it. The vehicle would be a PRP that we're familiar with. You put a PRP, you mix the stem cell, and then you inject it in the part. That's the technique that I learned from the A4M, American Anti-Aging Medicine. So the adult somatic stem cells are very interesting. They are found in the bone marrow, the skin, and the brain. Let alone, do not even open up your brain to harvest the stem cells. So that's a no-no. The bone marrow, we discussed, it is easy. Let alone bore a hole to the brain and harvest a stem cell. That's no good. So look at the skin. A Japanese scientist, Yamanaka, he looked into the embryonic stem cell in a microscope and pondered and reflected and was inspired. This is the same stem cell, the embryonic stem cell. That is the same stem cell that had grown into a human being like my daughter. for the kids. So then he resolved he will not touch embryonic stem cells. That inspired him to produce a an adult stem cell which he developed, and he was awarded a Nobel Prize in 1990s, I think. It's called induced pluripotent stem cells. He harvested the fibroblasts of the skin. He introduced 4 different elements, growth factors. In the ordinary adult stem cells, this became the adult stem cell that he wanted to do. So he used this to produce some kind of stem cell, for example, for the bone and many different tissues that he had studied. So stem cells are real. You have it. We can harvest it from the bone marrow, and that's my choice in terms of source of stem cell. You can never go wrong. And there's a regulation that stem cells can only be harvested in the clinic in the same roof and given in the same day, not traveled outside or put in a vial and give it sometimes. There are innovative companies that have done that, harvested some umbilical cords and all this stuff. That needs to pass through the accreditation of the FDA. In my opinion, the best would be to do it and autologous, meaning your bone marrow could be harvested here and give it right away and the same day, following the regulations of the ethical issue. We don't have problems, and also following the guidelines in terms of preserving the safety of the patient, avoiding minimally invasive harvesting and minimal manipulation of the cells, meaning your cell counted, not propagated, the same stem cell that it counted and injected to you back. That's the most I think, ethical way and more scientific way to do a stem cell therapy. There's so many researches. If you go online, there's so many promises that that stem cell can benefit patients. Hello, Ms. Josie Kate. I hope you're doing well. Please drop a comment, drop a question if you're interested in discussing more. The regenerative medicine is definitely the future. That's why the state of Florida is very responsive to the cost of supporting regenerative medicine, but in an ethical and scientific way, a safe way, which makes sense for the future of the safety of the patients. And since I'm board certified in stem cell therapies by a reputable group, A4M, I'm confident I can give a safe way of treating stem cell. I'm a practicing Catholic, and I abide with what my conscience would dictate me, and not to use aborted fetus or any product of flow and proximity of abortion. Umbilical cord is very interesting, and I did research on this in my paper, in my NCDC submission for bioethics certification. I noted that umbilical cord harvesting, commercial, can be a slippery slope. If you have an umbilical cord that's offered to you and you don't know the source, it's not you, because umbilical cord has to be very specific. For example, a woman harvested the umbilical cord of the baby. 10 years later, it was deposited in the bank. The woman developed leukemia. That stem cell saved the life of the mother, but that came from the fetus because of the genetic content of the fetus. But if you get it from somewhere else, umbilical cord, where did you get the umbilical cord? Could it be human or maybe something? Second would be, were there any ethical issues violated by luring the mother to harvest the umbilical cord after delivery, because there had been cases where there's some reports of harvesting the umbilical cord for sale. Um, there are, it could be the umbilical cord around the proximity of the delivery. So there's some commercial interest in that. We cannot name cases because I don't know, but I have in my research I've seen those reported cases. Even I wrote the paper in 2016. I have to go back again and revisit the topic. So that the question here is, what is the safety net of the umbilical cord? So it is best for stem cell therapy really to be harvested from you, and the best, to me, I think the most comfortable way is bone marrow aspirate. PRP, and it's easy to regenerate. You draw blood, spin it, and that becomes the vehicle of your stem cell therapy. So in the state of Florida, again, not yet, in July 1, 2025, allows the licensed physicians, MD or DO, to offer certain stem cell therapies, certain, that have not yet been approved by the FDA, but only for specific categories of treatment. Under the law, these therapies must be related to orthopedic conditions such as knee, joints, ligaments, tendons, arthritis, sports injury related, wound care, including some chronic or difficult to heal wounds, and pain management. And these are specific for back pain, chronic back pain. There have been indications, but these require special skill and special kind of um, setup. You have to have a fluoroscopy to dictate where that pain is. In the Florida law, it does not mean that stem cell therapy is approved for every condition. And with caution, many clinics advertise stem cell treatments for conditions such as Parkinson's disease, which I have mentioned, Alzheimer's, autism, multiple sclerosis, COPD, heart disease, erectile dysfunction, but not in the state of Florida would be allowed as an indication. For most of these conditions, there is currently little or no FDA-approved stem cell therapy, and evidence or effectiveness may be limited or experimental. Yeah, you can have an experiment in the hospital, if your heart muscle regenerate with stem cell therapy. And that particular scientist that I met in a conference uh, uh, studied the regeneration of the nerves, which is good. And I wish them success, that they can be successful. So in conclusion, stem cell or regenerative medicine, which comprises PRP or platelet-rich plasma, and also stem cell therapy, is a promise of the future. And I think we're living it right now. I took my board exam in 2016 with IFRM, and I was surprised the science was already there in 1990 or prior to that. The science is evolving, and now the state of Florida is helping us to go through the development of regenerative medicine. Stem cell has different types of character, different source. Certainly, abortive fetus or the cells, embryonic stem cells from the embryo, the blastocyst, is definitely not the stem cell that you would want to use. It has this danger of producing pretty much every cell that you would imagine. Adult stem cell has a safety net. It would regenerate to a specific cell that you want in the proximity of the damaged tissue, like the bone or the skin. For example, different types of tissue around the bone, the muscles, what do you call this, the ligaments, the tendons. Avoid the promise. Be cautious about the promise of treating a systemic illness. We cannot do that because there's no scientific evidence, there's lack of evidence, consistent evidence. People will claim, yes, that there is, my neighbor had stem cell therapy and became a useful one. Um, Not in the state of Florida. You have to prove the scientific evidence and also the effectivity. The ethical issue of the source of stem cell is very important because you're pretty much in the proximity of the evil act if you use stem cell from the aborted fetus, and also from the danger associated with it. Stem cell can be affordable depending on where you go, and in the state of Florida, um, you have to look for qualified physicians who can practice ethical medicine because stem cell can be very tempting to go into, and because it's lucrative. But if you go with your conscience on what you need to do, because you want to help people with almost like incurable disease, like incurable wound, for example, or the prospect of healing the damaged tissue, like the joints. But until recently, when my sister came in the last week and had some success story, even just with PRP treatment with osteoarthritis in the knee that complicated to tendinitis, the groin, and also the proximity, like the tendinitis around it was actually the knee, the hamstring muscle, or the quadriceps, sorry. It can be debilitating. Had she not come here talking about PRP and my sister, she would have just lie down in California and wait for whenever it would be because she was pretty much practically on wheelchair and cannot move even with a cane and living in pain chronically, could not sleep. How debilitating could that be? She keeps texting me, and the story was very dramatic. The first day, second day, there's significant improvement until she left. She arrived on Saturday and left on Friday last week. Now she texted me. When she was in the airport, the she was near the wheelchair and the what do you call this? The cane. Immediately, if you remember, she was able to flex her knee um, and walk without difficulty. She was able to shop with my daughters around Ave Maria. So that's really exciting. And she continues to text me. This morning she updated me. There's no, there's zero pain in her knee, in the groin, and she's able to go back again to the gym and whatever she needs to do. So regenerative medicine is really amazing. You just have to go to a proper, ethical, knowledgeable physician who knows the science and the application of this and not be lured by the false promise of PRP and stem cell therapy because it can be devastating to be part of an ethical practice of medicine and also um, unnecessary complications of stem cell therapy. So with that, we will entertain questions, and I hope Josie Kate will give us a question. Don't know where you are, Miss Josie. Please share us where you are, and live audience can start asking questions. Mary, do you want some stem cell therapy? You could use stem cell therapy. She's a lovely woman. Yes, we will. So the question is verbatim: what is the hoopla about the embryonic stem cell? Let's review. Embryonic stem cell is collected at day 5 or 6. Let's put it this way: in the beginning of life, the sperm and the ovum meet. This single cell becomes two cells. In day 2, it becomes a 4 cell. On day 3, maybe it will become a 4 cell. It grows fast. At day 4 or 5, it becomes a blastocyst. I think it's 16 cells. So there's a halo. This is a cell, the blastocyst. It forms like this. And in the lining, inner lining of that cell, the blastocyst, are pile of cells. Those are the embryonic stem cells. So they harvest that, and then that particular stem cell can grow to any particular type of cell. So imagine if you inject that in your body, it can probably travel anywhere to the bone, to the muscle, and then it will give you a lot of cells that you don't want in the food. Because people, I don't know exactly, but I think it's greed and power. In my opinion, it's rapid and you can collect it, but there's really no need. If you attend conferences, stem cell therapy conferences, they pretty much that embryonic stem cells are pretty much abandoned because there's some alternatives. Say IPS, induced pluripotent stem cells, for example, or the bone marrow aspirate. It can your own can be done safely in the clinic, and there's no anesthesia like systemic anesthesia or general anesthesia. It can be done locally, a local anesthesia on the bone. That's a bedside procedure. So let's put it this way. So the bone marrow aspiration, of course, you do the vital signs, maybe 5, 10. The bone marrow aspiration will probably take about 10 minutes. The procedure, PRP, will be another 10 minutes together with the stem cell screening and all. You're talking about an hour, maybe, minimum, or a couple of hours just to give the patient some rest. So, and people walk around and there's no downtime. My experience with the PRP, so just with the PRP, people walk right away. Yes, sir. Yes. No, not regenerative medicine up to date is not covering regenerative medicine. It was actually interesting because my patients, when I was in Valparaiso, they came and when they came, had a result. So they said, just out of curiosity, let me go to my clinic, my doctor. They went to Chicago and a very prestigious. I said, yes, it's covered by insurance, the PRP, not the stem cell, the PRP. But you have to pay a copay of 1,500. Well, the PRP that I give in the clinic was way cheaper cost of. So it's not regulated. So the depending on who is giving you, who's giving the therapy. Like a code, I would have to look into it's called a procedural code, the CPT code. I would look into it because that's usually triggered by Medicare and insurance, those CPT code. So I would not know. I would have to research on that one. It's irrelevant, really. I would say stem cell therapy usually starts around 5,000 up. Why? Because there's also cost associated with it, not just labor. You have to buy the kit to prepare the safety. So depending on where you're getting the kits, um, plus the time you're using the room, the expertise of the physician. So I think it's reasonable, 5,000. But really, stem cell therapy, if you go online, it's horrendous. 10,000, you have to travel the cost, you have to travel all this. So be prepared to spend money. But you are spared from surgery, you're prepared from, I mean, you're spared from those other things. Yes. Mhm. Potentially, yeah. Especially the knee and the shoulder. Because one, it is very accessible. Um, even the usual needle that we use for the knee, it reaches the ligaments that usually are damaged. For example, osteoarthritis, degenerative joint disease. What is the pathology of the degenerative joint disease or osteoarthritis? It's the synovium that produces synovial fluid that are slowly doing the wear and tear so that there's no more fluid inside the articulation of the knee. That's why you call it bone and bone. Even PRP has a prospect. There are papers here that I have actually I'm reading, and it talks about a good study, evaluation of a low-cost PRP platelet-rich plasma for osteoarthritis of the knee, which is a common knee. Regenerative medicine, pharmacological considerations, and clinical role in pain management. These are possibilities. And I've seen this clinically in my practice over since 2016. So we're now 10 years now? Oh my goodness, we're getting old. Yes. Mm. No. Because potentially you can still harvest the stem cell, reignite the stem cell, and that's the reason why you can. Yeah. Hmm. 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 Yeah. Hmm. Yeah. Yeah. To know the reason why it's swollen right now. We had knee replacement. What is knee replacement? Essentially scraping and taking away the gum from the knee. So essentially, what is the main pathology? Is the lack of the synovium, the cells that produce synovial fluid. Now you're very active. It's constantly irritating the synovium. That's why fluid is produced, because when you are irritating, it gives you pain, exudates, and redness. It's a classic description of inflammation. It's inflamed. So if you put PRP, you're um, putting in oil change. It's not even oil change, it's just putting a good oil. But that good oil has the potential to regenerate the synovium in theory. So that is the reason why knee actually is has a dramatic effect. I've seen it many times in my practice. Yeah. The other one. Yeah, that's right. Yeah. Um, it's a question of your priority. Yeah, yeah, go ahead. Ladies first. No, ladies first. I'm just joking. No, no, no. In fact, yes. So this paper addresses this study. They have studied this very much. You have to inject it into the disc. That's why you need fluoroscopy. You need a special setting for those kind of pathology. Yeah, looks like the paper is presenting that there's some reports. Further studies, yeah, was further studies need to be done. I myself would not go into that kind of pathology. I would send it to somebody else. Because you need a fluoroscopy. You know, fluoroscopy is an X-ray that your injection would be guided by X-ray live. So imagine you have to have an X-ray here. I'm not. I'm limited. I cannot serve everybody. Yes, epidural actually is also a semi-complex procedure. It needs also fluoroscopy. You need some guidance. I would probably limit myself to some wound healing, joint pains. I've had some success. I'm very comfortable treating even with therapy with tendinitis, tennis elbow, shoulder, myofascial pain, rotator cuff, frozen shoulder, those things. Because this procedure really is in the realm of the scope of internal medicine. We were trained to do these procedures. In fact, we did not get to um, it was a requirement for us to display our skills in terms of joint injection without ultrasound. This was how we were trained in internal medicine. For stem cell, it would probably be stem cell is very unique. One stem cell procedure. PRP, usually the protocol that people use is to need three series of injections 1 week apart. With stem cell, one procedure, and then it has a more active kind of release, depending on the pathology and also the severity. So that depends on the individual. Yes, yeah. Yeah. If you get a receipt from the medical facility. Yeah, yeah, that's right. Any other question? So this comes to a conclusion of what we have discussed today. The stem cell therapy, regenerative medicine at the prime, and we're capable of doing that. And we're committed to ethical, scientific-based treatment using the science of regenerative medicine. This is Dr. Raul Inad from Ave Maria, Florida. Hope to see you again next week. Have a good day.